Hello, my name is Matthew Ocasio. I'll be doing the video and the assessment today. This is my subject.
I'm Abdullah Umar. I'm the subject, and Matt has my consent for this video for this class.
All right, so today we're going to be doing the complex health assessment for head, face, neck, and eyes. So I'm going to start with chapter 13 first with head, face, and neck. So I'm just going to start off with some subjective questions. So, sir, thank you for coming to your checkup appointment. Are you experiencing any headaches?
No.
Okay. Do you have any history of head trauma recently?
No.
Okay. Have you been experiencing any dizziness recently? So that could be like being lightheaded or feel like you're about to faint?
No.
No. Good. Okay. Have you noticed any like weird like lumps or swelling at all?
No.
Okay. Any neck pains recently?
No.
Okay. And we'll be checking your range of motion and everything too, just in case. Any like surgical history that involves your head or your neck at all?
No.
Okay. So we're gonna start off with the assessment portion. All right. So for this, I'm gonna assess his head to see if there's any like swelling or like if there's any trauma. All right, so I'm gonna start. Okay, I'm gonna feel around the back. So far his head is normal, normal cephalic. His skull is symmetric, and his head is appropriate to his body size. All right, now I'm going to palpate his temporal artery. So no hardness, soft. All right, good. Now I want you to open your mouth, slowly, close it. Okay, so he had smooth movements. Okay, so can you big smile for me? Good, can you raise your eyebrows? Okay, good. So he has symmetric facial features and no random twitching or anything, so it's good. All right, and then for your neck cube, put your head back a bit. His head is midline to his neck. Trachea is midline. And you can put your head down again. All right, so what I'm gonna have you do is I'm gonna have you move your head left to right. Okay, other way. Good, and then I want your chin to touch your chest. Good, and I want you to look up. Okay, good, and then back to the center. All right, so I want you to look that way again, but I'm just gonna move my hand here, go against my hand, good. All right, go the other way. Okay, good, look down. Okay, look up. Okay, so patient is, range of motion is good. Patient was able to do the same motions with resistance, so neck muscles are strong as well. Now we are going to check the patient's lymph nodes. We're going to do two hands for this. I'm going to gently palpate the clavicle. Okay, good. So during palpitations, I didn't feel any swelling. Nothing was palpable, which is good. Next, I'm going to do the thyroid, which you can do posterior. I'm going to do it anteriorly. Make sure the camera's there. So, okay. So not really palpable, but there's also no bruit too. So the patient is normal. And do you have any history of any thyroid issues?
No.
Okay. All right, next we're gonna move on to chapter 14, which is the eyes. Do you have any vision difficulty?
I wear glasses.
Okay, well, are you nearsighted or farsighted?
I'm nearsighted.
Okay, and do you remember what your vision is?
0.5.
For both eyes or?
Both.
Okay, and when was your last vision test?
A year ago.
A year ago, okay. Are you experiencing any pain?
No.
Okay. Have you ever had a history of like cross-eyed?
No.
Okay, good. Do you have any redness or swelling today?
No.
When do you ever have redness or swelling?
When I have allergies.
Allergies? When do you usually have allergies?
Like pollen season.
Pollens. Okay. All right. And have you had any like eye injuries at all?
No.
Okay. For your job, do you do anything that strains your eyes?
Sitting at a computer all day.
Okay. There we go. All right, so your last vision test. So now we're going to start off with the Snellen chart. So I want you to turn this way, and I want you to read the first letter.
From here.
Yes.
E. Your car. I or
Yeah.
E.
What's the second one?
F P.
Okay, next one.
T O Z.
Okay, how about the fifth one?
P E C F D.
All right, how about the sixth one?
E D F C Z F.
Okay, and then try it with your glasses on.
Which one?
We'll do line 6.
First one cover.
Oh, you're good.
Line 6. E D F C Z F. Oh, it's P.
Oh, okay, good. All right, so that was the Snellen chart. Next we'll do the confrontation test, which is where I will have him close one eye each, and I will move, and I'll move my fingers. It's testing his peripheral vision, so when I move my hand near his peripheral vision, I'll have him say now. All right, so what I'm gonna have you do, I'm gonna have you cover one eye. Okay, I'm gonna stand a couple of feet in front of you. And then when you see my fingers come near your peripheral, just say now, okay? If you can't see it, don't say now, okay?
No. Both of them or just one?
Both.
Okay.
Well, whatever one's in your peripheral.
No.
Okay, good. We'll do your other eye.
No. No.
Okay, good. All right, so peripheral vision is intact. Okay, so now we're gonna do the cardinal positioning, the diagnostic position test. So what I'm gonna do is I'm just gonna move my finger in 6 different directions. You just have to follow my finger, okay? Okay, so the patient was able to follow my finger without any problem. He had minimal to no nystagmus, which is like the eye twitching. Next, I'm going to check his conjunctiva and sclera. So what I'm going to have you do is I'm going to lower just the bottom of your eyelids, okay? Okay, so eyeballs are moist and glossy. There was no redness. Conjunctiva is white. Just some small blood vessels, but that's to be expected. Eyebrows are symmetric, facial features symmetric. Eyeballs are symmetric and aligned. Okay, and then I'm just gonna check his lacrimal apparatus. I'm just gonna put his eye down, see if there's any redness or swelling. Okay, good. Good. All right, and then next we're gonna check out his pupils. I have my pen light. There we go. Never get these for free. Okay, so pupils before were 3. During the exam, pupils went to 3. They were brisk and round for both. So what I'm gonna have you do is I'm gonna have you look at the pen. Okay, keep looking at the pen. Okay. So patient is Perla. Pupils are equal, round, reactive to light and accommodation. And then next I'm going to shine the light on the side of his eyes to do the corneal light reflexes. If you look forward. Okay. Actually, hold on, I got a good view. Okay. Okay, and that is my assessment for head, face, neck, and eyes. Thank you.